Hello there, it's Sam again. Nice to see you. Today, we are going to talk about the rights to humane treatment, humane discipline, and the right to be free from chemical and physical restraint. First, let's talk about that word humane. Humane is a way to describe treating someone or something with tenderness, compassion, and sympathy, and acting in a manner that causes the least harm. So when we talk about humane treatment or discipline, we are saying that even with medical treatments and discipline, people are treated with tenderness, compassion, and sympathy, and in a manner that causes the least harm. But that might still not be completely clear. So let's break it down even further. So, humane treatment. Some medical tests, procedures, and surgeries might be a bit uncomfortable or even painful. The doctors, nurses, and medical professionals should do what they can to support us through these treatments by treating us kindly and offering us pain medicine when that is an option. I think about having to have surgery once. The doctors gave me medicine so that I could be asleep and comfortable during the surgery, and then checked on me and gave me medicine to help with the pain before I left the hospital. And then they checked on me again a few days later to make sure that I was doing okay. The doctors treated me with kindness, compassion, and sympathy. They tried to help me with the pain. They didn't make fun of me or get angry with me or expect me to just deal with it. They were kind and they helped me feel better. That is humane treatment. Next, humane discipline. Sometimes people might break a rule or do things that they should not. Sometimes that means someone has to step in and correct the behavior. That might be a parent or a staff, or in extreme situations, maybe a police officer. Sometimes the behaviors make it so that a person is in danger of hurting themselves or someone else, and to protect them, staff or law enforcement may need to take action to protect that person, property, or others around them. Those actions may include using handcuffs or other equipment, or having someone else physically hold on to that person to keep them from hurting anyone or anything. As you might imagine, this can be quite upsetting. Humane discipline means only using the minimum amount of force or restraint necessary to control the situation, remaining calm, not making fun of or getting angry with the person, and trying to resolve the situation quickly and safely. That's humane discipline. Being free from chemical and physical restraint kind of goes along with humane treatment and discipline. First, we have the right to be evaluated by a doctor before beginning any sort of treatment to address negative, unusual, or bizarre behaviors. The doctor will do tests and check everything out to make sure that there is not something wrong medically that's causing the behavior. Then, if it's decided that using a medication or some sort of restriction or restraint is the best way to help with the behavior, then the doctor will help decide how much medicine is needed and how often it will be taken, or the type of physical intervention that is safe to use. The doctor will follow up on a regular basis to make sure that everything is going the way it should and make changes as needed. Being free from chemical restraint means we should not be forced to take so much medicine that we can't continue to live our lives freely. We don't want anyone to feel or act like a zombie because they're taking too much medication. Being free from physical restraint means that we should not be chained up or locked away all the time, and that if something happens that makes it necessary to use physical or manual restraints, that everything is used in the correct way and that we are being careful to pay attention to that person so that they are safe. So that is today's rights: the right to humane treatment, humane discipline, and the right to be free of physical and chemical restraints. Take care.